Welcome to eAssist Growing Your Dental Business podcast. Tune in as the experts in dental business share tips and tools to grow your practice. To learn more, visit dentalbilling.com. Please welcome our next guest.
Hey, everybody. Welcome to the Growing Your Dental Business podcast, where we explore strategies to help dental professionals build thriving practices. I'm your host, Jacqueline Hurley, and today we are tackling a challenge that nearly every dental office faces, managing and collecting past due patient accounts. So joining me today is Ron Cash, who is a seasoned expert in the collections industry. He is a licensed collection agency manager, and he has over 44 years of experience working with practices. He helps businesses streamline their past due patient accounts. He helps recover more outstanding debt with minimal expense and can automate the process to improve cash flow. Ron is with Transworld Systems Inc, which we will fondly give the acronym of TSI, which customizes collection solutions that fits the needs of each dental practice. TSI allows practices to keep 100% of what's recovered for a low fixed fee, making it one of the most cost-effective ways to reduce bad debt. He also works closely with the Michigan Dental Association, conducting workshops to educate dentists on best practices for managing accounts receivable. And one of the things he told me a couple of weeks ago, which I thought was kind of cool, is he said, long before PCs were ever in the office, TSI pioneered patient communication automation using mainframe computers to send systematic written notices, a strategy that will deliver results still today. So, Ron, welcome to the show.
Thank you, Jacqueline. I appreciate you inviting me.
Yeah, it's lovely to have you here. So, to start, can you talk about or tell us some of the challenges you help dentists and their teams solve?
Sure, absolutely. Maybe just a thumbnail on the TSI, how I got engaged here. I used to work for a hotel in the collection department, and TSI wandered in with a meeting with our department head, and I sat in the meeting, escorted him out of the building, and next thing you know, we were having lunch the next day, and I quit my job on Monday to open their sales office. Wow. It just seemed like a no-brainer to me. I knew we had the need. They had a very automated, very low-cost solution. And I said, we'll be signing up, whether it's me being the rep or you being the rep. I'm not sure which, And they were my first client, and that was August of 1980. So I'm going on 45 years this August, which is crazy.
That is crazy.
Yeah. And 4 daughters later.
You probably started when you were like 10, I don't know.
Yeah, right out of college, let's say.
So you have 4 daughters, is that what you said?
Yeah, I do. My wife and I just celebrated 38 years and still got 2 at the university, Michigan State University, who's in first place in the Big Ten right now.
Wonderful.
Yeah. Anyways, I immediately in the early 80s gravitated to the Detroit District Dental Society and had been working the statewide relationship out of East Lansing area or Okemos, Michigan for a number of years. And it goes back 15 years now that they have endorsed our services by the MDA Services Committee. And we just love the relationship. We do their workshops, we do webinars. And last April, I did a roundtable at 7:30 in the morning for about 30 dentists that showed up. So that was very fun. And I'll cover a few ideas before I go. But I think you asked earlier what makes us unique in the industry. I mean, there's a few thousand collection agencies. And when I started with TSI, they were a $5 million company, according to the Dun & Bradstreet report. We are now pushing $500 million. We're more than double the size of the second largest agency in the United States. There was a time in the 80s that we got purchased and we're on the New York Stock Exchange and we were part of a public company. And we all thought we died and went to heaven because now we're like, we got numbers we can share.
Yeah.
But what really attracted me to TSI and is the logic of using automation to collect the money through an automated series, through the mail to the patients. And 90% of the time, those letters get into the household, really closer to 95% of the time. They're not always read, they're not always opened. But once they realize a collection agency is engaged, the priority of looking at what's being said goes way up. And yes, they get defensive and they get a little upset and they're worried about their credit rating, et cetera, et cetera. Even though medical and dental debt has been kind of relaxed in the last year or so for credit reporting balances, minimum $500. We wait up to a year before we would credit report, and it has to be over $500. And not all practices, indeed, most practices don't want to report to the credit bureaus because it kind of ruins the relationship. Once you do that, that stays on there for 7 years, even if they come and pay. So it creates some angst and bad will, if you will. And the word of mouth is a lot of the ways that dentists get their business. So you don't want to really get your patients upset.
Sure.
On that note, especially. But what makes us, again, unique is something I never heard of. That TSI, after somebody pays in full from one of the automated 5 notices, we send a thank you letter to them. We acknowledge the payment. We let them know that we're extending the thanks of our client and thank you for your cooperation resolving the matter. If your need arises, our client's services are at your disposal. So we send that out on our postage. We pay the postage on that as an extra added benefit to the 5 notices that we send.
Nice.
And a lot of people will pay after that 4th and 5th notice. It's, repetition is the mother of motivation. And that's how that's how I get my kids to clean their room or make their bed. That's how I get people to pay their bills. Just every 2 weeks, we're sending out another notice. And generally, people are getting paid every 2 weeks. So we're kind of in sync with their pay periods.
Well, I love the automation that you guys have set up. That's probably a game changer for dental practices.
Mm-hmm.
And I mean, I can only imagine how it can impact the practice's financial health.
Sure. Let me expand on that a little bit. We started this well over 15 years ago. We engaged with a company that publishes in Dental Economics magazine and does annual surveys for dentists and what they charge in areas by zip code, by cities. And they have a program called the Practice Optimizer that they provide to practices. It's kind of a dashboard to help better run practices. And their company is SikaSoft, and VJ Sika is the founder of it out in California. And I've been in many meetings with him and his team. But he's built the dental interface to Dentrix for eCareStream, Easy Dental, Dolphin, OMS. And then we've also have standalone interfaces with Open Dental. They've embedded us into their system and recommend us also with Mac Practice. So not that many practices use Apples, but they're out there. I have one in Troy, Michigan here. It's a client. So it's nice to have a built-in way it does 3 things. It flags the accounts at a certain age with a certain minimum balance. Then it provides it in a list or a queue that you decide you can check a box or uncheck the box and send it, or put it into a do not send mode if it's a family member or a friend of the practice or a 90-year-old lady that you just don't want to send a letter to, So there's ways to keep it pending, not send it, or send it. And so it'll stay there until it's eventually moved into one of the 2 modes of either send or don't send. But it gives you that control to see what's out there over $50 or $100. And after X number of days, maybe 90 days, you want to start looking at those. So that's just easy. Press of a button to hit send. And nobody has to go to our website and key in data. Nobody has to, think about where the files are and reread through the files to get the data to us.
That's nice that it gives them that flexibility and control at the same time. Mm-hmm. What have you come across that's the average amount that dental offices have outstanding in their accounts over 90 days?
So on average, the average balances are in that $300 to $400 range per patient. Believe it or not, the surveys that I receive from Sika that usually get published every year and are available to their client members, the number has been consistently above 40% of the AR is over 90 days outstanding. And it's kind of easy to understand because a lot of practices don't even think it's a problem until they miss their 6-month semi-annual visit or biannual visit. So when they come in and, oh, by the way, you have a balance from the last time, they can clean up a lot of those, and they will get those taken care of, unless the, husband or wife or patient are, a little bit evasive, maybe short on dollars. And having those outstanding balances actually can hurt the chance that they will make that 6-month appointment, because they are aware of the balance that's from 5.5, 6 months ago.
Sure.
So they may postpone or not show. And that just, not do we charge them a non-show fee and, appointment break fee or whatever. And it just could make the matter worse. So the old wives' tale might be, a stitch in time saves 9, right? Or addressing nip it in the bud when it's early and resolve those problems. I prefer to think that if somebody hasn't paid in 60 to 90 days, internally, there has to be that policy procedure written. What do you do? How many frequency, at what frequency do you communicate that somebody's got an outstanding bill? And that's a discussion the office manager or biller has to have with the practice manager or the doctor. And generally speaking, if you wait 30 days and then just send another statement 30 days later, is sending a third statement 30 days after that going to move the needle? Probably not. There's that relationship that you have. You need to leverage that and explain, hey, the doctor provided their services over 60 days ago and we still haven't received payment. Is there a way you can take care of that today? And I get it that calling 50 patients might only get through 5 or 7 or 8 times to the person you're trying to communicate with. But if you don't have the staff to do that, then automation and automated procedures are what you want to rely on, whether that's your system that will generate those every 2 or 3 weeks, another notice in the mail, not just a statement, but a letter, a soft letter. And so, I've been marketing profit recovery as an extension of what clients do internally, because the money still goes to them and they keep 100% of it. So I see profit recovery, our signature program, as an extension of what they're doing internally, and they still maintain the relationship, control the dialogue, what's being said to the patient. And then after that, they decide whether they want to transfer into the call center collections, like most agencies, where we charge 35 to 50%.
Sure. What do you charge up front that's different just with your automated letters?
Sure. So the automated letters typically, especially, for example, in Michigan, Wisconsin, Minnesota, Georgia, Virginia, were endorsed by the state dental associations, and there's a few others that I just didn't mention, but we give about a 15% discount on our price for per account. But generally speaking, people are paying between $12 and $16 an account on average. If you have more than 2 or 3 accounts a month, you're probably closer to the $12 or $13 range. If you only have, one account every other month, then you might be paying a higher rate up to the 16 and even up to 17. We do have a month-to-month service agreement, so they don't have to pay up front, and that's at about $17 an account. But most qualify for the 2 to 3 a month that they would be sending to profit recovery as it hits 90 or 120 days. And that's generally at that $13 to $15 an account. Depends if you're a discounted endorsed service membership.
Cool.
Like
Sounds like it's pretty minimal, really.
It really is. And in fact, when we met with the MDA Services Committee, I explained that, with an average balance of $400, if you're paying Visa, MasterCard 2 to 3%, that's $8 to $12 just to do the transaction, just to take the money in an instant. Whereas we're working it for 75 days for $10 to $15, as opposed to just doing the transaction for, $8 to $12. So it's a flash. And whereas our process works out to be about around 20 cents a day to run it through our system. And the money comes back to the practice. Again, you go into your system, you post the payment in Dentrix or CareStream or whatever. Sure. And then that lets us know that it's been paid, and we send out the thank you letter.
Nice. I love it. That sounds So before we wrap up today, is there any piece of advice that you would give to dental practices that are struggling with past due accounts?
Yeah, three things. One is have a policy paper, an AR policy procedure paper. It doesn't have to be a manual, right? You can put it in there. And that would basically, again, I mentioned earlier when I did the roundtable, how do you deal with past due accounts? When do you get concerned with a past due account? Is it at 60? Is it at 90 or 120 or 6 months? And some people are going to be all over that spectrum. But asking your staff at 60 to at least make 2 calls or send out a soft reminder letter separate from the automated statement, that can be a big needle mover. And after the 2008 and 2009 financial crisis, we came out with a program that our clients were asking us to do, and it does actually that. We call it Accelerator. And if they look at the PDF in the chat thing that you might be able to post in there.
In the show notes.
Okay, in the show notes, they'll see the 3 Accelerator, Profit Recovery, and Collections small descriptions. But it's an automated series of 2 soft letters, 2 automated calls with the caller ID of the practice, nice. And then a final reminder letter. So that Accelerator can resolve 40, 50, 60% of the accounts at 60 to 90 days before it goes to the agency series that we call Profit Recovery. And that's another 70, 75-day process before a live collector ever picks up the phone. So generally speaking, combining Accelerator with Profit Recovery, you should resolve 60 to 70% of your accounts.
Nice.
And that can really save the practice a lot of money because, again, the little fixed fee is a lot less than paying 40 or 50% of the revenue.
That's amazing. That sounds great. Those are great tips too. If they, just get those systems in place.
Exactly.
Yeah. So just to our listeners today, just after you've listened to our conversation, if there's any ideas sparked about optimizing your cash flow in your practice, remember having the right systems in place and support is essential. This podcast is sponsored by eAssist Dental Solutions. At eAssist, we help practices eliminate the headaches of insurance dental billing by ensuring clean claim submissions, faster reimbursements, and more efficient revenue cycle. And if you find yourself falling behind on collections from patients, a company like TSI can help recover those outstanding receivables with ease. And with eAssist handling your billing and TSI supporting your collections, you can focus on what is doing best for your practice and providing exceptional patient care. So thank you, Ron, for joining me today. I appreciate you being here.
Jacqueline, it's been my pleasure. And 877-RON-CASH will get you to my cell phone. So if anybody has any questions, 877-RON-CASH, just spell that out on your keypad.
I love it. And I will also put that in the show notes so that you'll be able to have access to Ron. I really appreciate you being here today. It's nice to hear a little bit about you and the things that you're doing. And sounds like you just got back from San Diego, so you're back to the cold, it sounds like.
I am, and it was so nice out there. But thank you. Thanks again for inviting me.
You are welcome. And everyone, have a great rest of your week. Take care.
The purpose of this podcast is to interview the consultants within our eAssist Consultant Network. This podcast is for informational purposes only. For more details, please visit the homepage of this podcast platform at dentalbilling.com. Thanks for listening.